Dr. Jackson from Texas for 5 minutes of questions.
Thank you, Mr. Chairman. Thank you for our witnesses. Thank you for being here today. A lot of this has already been said, but I'm going to state it anyways because I do think it's important. But early on, COVID was a black box. No one really knew how infectious it was. We didn't know what the true morbidity and mortality of this disease was. No one knew who the truly vulnerable populations were. But we started pretty quickly to figure this out. And one thing that we learned very early on was that children were not the at-risk group in this disease. They didn't get COVID easily, they didn't spread it, and if they did get it, they did not get seriously ill and die from it, despite some of what we heard. We also knew that masking and school closures were having a devastating effect on social development, academic performance, and rise in youth depression and suicide. Despite that, there was no course correction. And the White House, Democrats at all levels of government, and the public health sector, which, by the way, has lost all credibility and trust of the American people at this particular point, all doubled down on these destructive policies. Why? Why were these decisions being made? Who was actually driving these bad decisions, you have to ask yourself. We know now that the teachers union, and specifically AFT and its president, Randy Weingarner, were aggressively pushing this destructive agenda. Why were they doing that, you ask yourself? Well, number one, in my opinion, is because there were billions of dollars at play here. Billions. Billions of dollars which would ultimately be controlled by the teachers union. Since 2020, Congress has actually allocated $190 billion to the schools. $7 million of that went to the teachers union. The intent of which, the $190 billion, was to reopen our schools and get back to normal. However, that did not happen, and the teachers union continued to support school closures. Liberal politicians continued to advocate for more money and support of the union. Why? And more money, more funding, more government money for this purpose. Well, I'll tell you why. It's because a large part of that money was going right into the re-election campaigns and the coffers of those very Democrats. In fact, the teachers union gave $20 million to Democrats in the 2020 election cycle alone. This, in my opinion, was the biggest driver of all of this. However, it didn't help at all that the teachers, administrators, and other school employees were being paid to stay home as well. And the teachers union was once again promoting this for political reasons, with complete disregard for the health and the well-being of our children. Some of this, a perfect example of this, recently published, this CDC reports, the CDC admitted that there were errors in their CDC reporting. These errors, they admit, resulted in exaggerating the severity and the risk for children. They also resulted in at the time in the continued CDC recommendations to keep kids at home. These recommendations, we now know, were developed in conjunction with the teachers union. This is politics, not science. Ms. Mazek, I wanted to ask you, are you a member of the teachers union?
I am not.
You're not?
National Association of School Nurses is a 501c3 member organization.
Thank you. You are the executive director of the National Association of School Nurses. Is that correct?
That's correct.
Were you the director in February of 2021?
I was.
Okay. And I know this question's been asked, but I think it's important. But I want to ask one more time. Were you consulted by the CDC or the White House or anyone else regarding recommendations for in-person learning?
The term consultation means that I really need to look at data and documents.
Did you get a phone call? Did you receive a letter? Do you remember having any conversations?
I received a
Not
letter
today,
today from
before,
the chairman asking for me to provide
I'm not talking
information
about that
from
today.
our
That's
association.
fine. I'd love to. We'll get that letter. We'd love to find that information out. What I'm asking is, at the time when these recommendations were being made, did you receive any phone calls? Did you get any letters? Did you have any communication with somebody at the White House or somebody at the CDC regarding in-person learning?
You're asking me to go by my memory. And
I'm asking you, you were the executive director. This is the organization that you were in charge of, and you can't remember if you had any type of conversation about that.
Sir, I will fulfill what the letter asks me for, and I ask that you would respect that.
I will be happy to look at that letter when we get it. I think it's very concerning that you can't remember, as the executive director, whether you had any type of conversation or any type of communication about that at all. I mean, I think you could easily say, I did, I don't know the detail, I don't know that, I can't relate to you the extent of which these conversations took place. I'll get that to you in writing, but you're saying you do not remember having any of those conversations.
No, I don't. What I do know is that the National Association of School Nurses depended on the guidance that was issued from the CDC.
I understand that. What I want to know is, did they participate in developing that guidance along with the teachers union? I think this is a very important question. I think that we're going to get to the, this is just the beginning. We're just starting to scratch the surface of what happened here. When we find it, when we see something that doesn't look like it's not right, it usually follow the money and you can figure out exactly why this stuff happened. So I'm excited about looking into this and finding out exactly what drove all of this, where that money went, and who made these decisions. Thank you, Mr. Chair. I yield back.
Thank you. I would now like to yield to Ranking Member Ruiz for a closing statement, if he would like to make one.
Yeah, thank you, Mr. Chairman, and thank you again to all of our witnesses for your participation. It's clear in-person learning is critical to our children's health and well-being, both inside and outside the classroom.
Thank the gentleman, Chair, and I recognize the gentleman from Texas, Mr. Jackson, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Secretary, and thank you, General Milley, for being here today. I appreciate it. Have a couple of district-specific questions for you here. My district is the 13th Congressional District. It's the home of the Pantex plant, the United States' only nuclear assembly and disassembly plant that we have. For the past few decades, DoD has stressed that it's placing a renewed emphasis on the strategic deterrence enterprise, and the Pantex plant is an absolute key component of that effort. There's no doubt about that. While DoD has been committing resources and seemingly doing its part, there doesn't seem to be concert or unity of effort between DoD and the Department of Energy on updating Pantex plant's severely aging infrastructure, which is actually, I think, having an impact on the mission right now. General Milley, I just want to ask you real quick, can you update us, or do you have anything to update us with on coordination that's occurring between DoD and the Department of Energy regarding Pantex plant, given Pantex was slotted to receive hundreds of millions of dollars for improving the facility the past several budget cycles, with those same projects now being zeroed out in the President's current budget?
I'm going to have to take that for the record, Congressman. I apologize. I'm not familiar with the specifics of the DOD coordination on Pantex, but I can get you a written answer here shortly.
Yes, sir. I appreciate that. I think it impacts, the Department of Defense as well, obviously. Also, as you gentlemen know, the Army is dependent on vertical aircraft in nearly every aspect of operations. 20 years of the global war on terror taxed Army aviation assets such that the H-60 and the CH-47 have been maxed out now, and it's necessitated that we have to have a new vertical lift option now. In December, the Army selected Bell Helicopter's V-280 platform to fulfill the Army's requirement for future long-range assault aircraft. However, the contract award has been protested, and we're looking at a GOA decision, hopefully sometime this week. I don't know. But, General Milley, I was going to ask you, have you reviewed the contract award process the Army used in this case? Are you confident that the Army used a justifiable and defensible methodology to make its selection? And is the Army doing everything in its power to defend its decision on this contract award before the GAO?
Thanks, Congressman. As a matter of course, I do not review contracts. I did that as a Chief of Staff of the Army, but as a chairman, I'm much more in an operational role. So I don't review those, but I'll circle back with the OSD folks who do that to ensure that, but I do know it's in protest. So I don't want to make any public comments that would jeopardize anything in protest.
I understand.
I do know that future vertical lift is one of the key priorities, one of those big 6 priorities that we talked about earlier with the Army Features Command. But
yes,
as far as the contract itself, I'll have to get back to you on that as well.
Yes, sir, I understand. Okay, I have 2 more questions real quick to hit on. Some of it's already been hit on here already, but I just want to start by saying, General Milley, I do appreciate your 40-plus years of service to this country. Having served 25 years on active duty myself, I know what a burden that is on you and your family. It's no secret that I've got a little bit of an issue and had a little bit of an issue with some of the stuff that's happened in your last job here as chairman over the last few years. We've talked about that before, but I do want to say that I do think that politicization of our general and flag officers has become a real issue in our military. I think that it does have a big impact on the forces in general. You know, mentioned by Congressman Johnson here, some of the polls that were out there on just the public's opinion of what that matters. You know, and General Milley, I'll just say, you know, whether it's real or whether it's perception, I think it matters. And I just want to point out, like, it's not just me saying it. You know, there's an article that came out in Politico here on the 24th of March, just a few days ago, 5 days ago, and the title of the article is "The Surreal Post-Trump Embrace of Mark Milley. In spreading the gospel of an apolitical military, he's becoming a political lightning rod and a reminder of how far Washington is from normal." So I'm just going to leave it at that. I have a question I'll just give to you off the record.
I can just tell you that I am committed to an apolitical, nonpartisan military, myself, on down, 100%. I read the article.
Yes, sir.
The media is the media.
Yes, sir. And I understand, and sometimes perception is not reality. But I think you will agree with me that perception has a big impact on your
Military's
ability
got
to
no
lead.
role in politics.
Yes, sir.
period.
So I appreciate that. With the last few minutes I have here, Secretary Austin, I just wanted to ask you, we've talked about the DEI initiative going on in DOD right now. I think that, we've heard I've heard lots of times in lots of different conversations about the potential positives impact of that, but I think that there is a negative impact of that as well. I think that it has an impact on readiness and it has an impact on recruitment and retention. I think it creates in some circles an environment of hate and discontent when you're pitting one group against another. It's identity politics to some extent. I think it's damaging. I just want to know, were there any studies that were done before this was rolled out, unbiased, scientific-based studies that showed that this was a good idea?
Gentleman's
Is there
time's expired. Chair, and I recognize.
I now recognize Dr. Jackson from Texas for 5 minutes of question.
Thank you, Mr. Chairman. I appreciate it. Thank you to our witnesses for being here today. For over 2 years, many Americans, just like myself, have been demanding that an investigation into China's role in the development of this vaccine, or this virus, and their efforts to cover up the virus after the fact that it was released, leading to this global pandemic that have killed millions and destroyed billions of lives. We've been demanding that for a while. I'm glad we're doing this now. I think we're way behind the power curve on this, but I just want to start off by saying, other than the Chinese government, the entities most aggressively trying to actively spread misinformation about the origins of COVID, trying to actually create and spread what they would have you believe was scientific evidence or scientific opinion, and I'm referring in particular to things like the proximal origins document, a document that was intended to provide fodder to harass, label, threaten, cancel, destroy anyone with any other opinion, specifically an opinion that this came from a lab, from the Wuhan lab in particular, an opinion that we know now was accurate. The people that were most interested in doing just this were people like Anthony Fauci, Francis Collins, and others at NIH. It was Peter Daszak and Eco Health Alliance. It was Dr. Tedros at the WHO. And of course, it was our unbiased and purely factual cable news networks like CNN and MSNBC. Director Ratcliffe, do you know if there were any instances of the U.S. intelligence agencies, did they share information, did they cooperate or collaborate with any of the entities that I've mentioned or the individuals that I've mentioned to either suppress or get out information that was contrary to what we're talking about today that we know to be the facts?
As I understand your question, Congressman, were any of the scientists or individuals associated with any of those groups, did they have
were there interactions with the intelligence agencies?
They did have interactions. I don't know the answer to all of them, but some of the individuals that I know, for instance, Dr. Peter Daszak, Dr. Farrar, Dr. Gary, I believe, were all at some point in time briefing various entities or agencies within the intelligence community about this virus.
Well, one of the things I'm wondering, we're looking back now and we're realizing that some of these intelligence agencies probably had enough information to make a solid determination that this most likely came from the lab in Wuhan as far back as a year or more ago. My question is, were they sharing this information with these people that were putting out contrary information, that were being propped up as the experts, that were giving us things like proximal origin, using it as evidence to completely undermine what I think the intelligence agencies knew to be the truth a long time ago? Was there an active push within the? And I ask that because you may have realized after the fact, because I think you had mentioned at one point that even within the intelligence agencies, you as the director of national intelligence were being kept in the dark on some things, or not being fully briefed, or maybe not being read into everything that was going on, because people that were subordinate to you were doing things maybe for politically motivated, or they were saying that they thought that they didn't want to draw politics into it. But I think, in my opinion, they were politically motivated themselves. Was there any effort on the side of the intelligence agencies to correct what was misinformation, what they knew to be misinformation at the time?
Well, I can only speak to the personal knowledge that I have, and the efforts that I engaged in was, as we found information and intelligence that was inconsistent with things that were some of the individuals that had consulted with the intelligence community had stated, we went through a process to declassify as much of that so that you would be aware. Or the State Department fact sheet that has been referenced a number of times about researchers being sick at the Wuhan Institute of Virology, coronaviruses, including the one most similar in nature to what became COVID-19, and the Chinese military's involvement. Those were all pieces of intelligence that I worked to get out publicly with Secretary of State Pompeo through a declassification process. So from my standpoint, my personal knowledge was where we became aware of inconsistencies like that, we did our best to make that information available publicly.
Thank you. I mean, I guess what I'm a little bit worried about is I'm just worried that there was a process here where the intelligence agencies were purposely not sharing information or not coming forth with the information that they knew to be true because they were being influenced politically by what was going on in the White House or elsewhere.
Yeah, and I think that, as again, I didn't just, there were instances that were documented by the analytic ombudsman that reflect the fact that when it came specifically to China, the country of China, that some of our intelligence and our analytic judgments were impacted by partisan politics and the desire for intelligence not to be used by one party as opposed to another.
Right, and I bring this up because I think it happens in this administration for the last 2 years. It's happened in the military. I think it happens in our intelligence agencies. These are people that we pay to be nonpartisan, to protect us. We pay them because of their expertise so that they can make sure that our national security is intact. And I think that if there's any of that going on behind the scenes, we need to get to that. People do not need to be making decisions based on their political beliefs or their political alignments. If it's going to impact, something like, our response to COVID.
I agree completely.
Thank you. I yield back, sir.
I now recognize Mr. Garcia from California for 5 minutes.
Thank you very much, Mr. Chairman. Thank you to our witnesses. I do want to start, Mr. Chairman, by just responding to one of the committee members who just made some comments trying to link the origin.
Now recognize Dr. Jackson from Texas for 5 minutes.
Thank you, Mr. Chairman. I appreciate it. Due to the constant inconsistencies, the contraindication or the contradictions and the lack of transparency from the Biden administration, CDC, the FDA, and the White House as well, many Americans have lost trust in our public health officials, and we've talked about that at length in a variety of these hearings. As I've mentioned before, regaining America's trust in our public health officials should be among our top priorities right now. But to do so, we do have to expose some of the misinformation and the misconceptions that were used, unfortunately, as an excuse to disrupt and control almost every aspect of our life for quite some time. Director Walensky, this is a tweet that you posted in August of 2020 before your tenure as CDC director in response to a tweet from previous CDC director. He writes, am I hopeful that we will have a vaccine in the coming months? Yes. Do I think this will get us back to pre-COVID reality? No. Vaccines take a long time to get to people. They often have stumbles in rollout, and they don't protect perfectly. It's very important, but it won't end COVID. And you replied, spot on. Combating COVID-19 requires a comprehensive, multi-pronged approach: masks, tests, treatments, vaccines. Those holding out for a vaccine alone are going to be sorely disappointed. Time to beef up the dimensions we have on hand already. In this tweet, you clearly indicate that vaccines alone will not be enough to combat COVID-19. However, as the CDC director in July of 2021, you coined what I believe to be a divisive slogan, the pandemic of the unvaccinated, suggesting that unvaccinated are the reason the pandemic persists, and to some extent pitting the vaccinated against the unvaccinated, which I don't think did any favors. This appears to directly contradict your 2020 tweet. What caused you to reverse your opinion?
I wouldn't call it a reversal of opinion. All of our guidance has demonstrated that we have layered mitigation strategies. We have all of the things that I comment on in the tweet. What I meant by the pandemic of the unvaccinated is that the people who were dying were largely the unvaccinated, and the whole point was to say, if you want to prevent severe disease and death, you should get vaccinated. You can do all of these other things, and all of them help. There was all this layered mitigation that we were promoting at the time. So I would say that that tweet and my actions as CDC director and that comment were actually all internally consistent.
Did the White House or any other official in the Biden administration pressure you or suggest to you that you should make statements that painted the vaccine as the primary solution for the pandemic?
No, but it was very clear from our vaccine effectiveness data that it was going to be one of the major things that helped us get out of it. I mean, we were seeing that at the CDC in all of our vaccine effectiveness data.
But I think you said earlier, you said that early on the vaccine was very effective, but later on it wasn't as effective, and people that were unvaccinated or people that were vaccinated were being hospitalized and were dying because the vaccine was no longer as effective as it was initially. Is that what you said?
I don't think I said it exactly that way. I think that over time we saw vaccine effectiveness wane, and over time we saw less effectiveness with the Omicron variants and their subvariants. But still to this day, we see remarkable effectiveness at preventing ICU stays and preventing death if you've been vaccinated and boosted with the most up-to-date booster.
Honestly, I don't agree with I don't disagree with your initial statement, the tweet that was sent out. What I disagree with is the later statement that, that only the unvaccinated, are dying from this. At the time, this was a year into it. This was July of 2021 when you made the statement about the pandemic of the unvaccinated. We knew at that point that to be true what you stated earlier, that the vaccine was not as effective as it was before, and even if that applied initially, it no longer applied at that point, that far in. So what I'd like to know is, did political pressure ever impact your CDC guidance on your public statements about the COVID-19? Did you ever feel like you were making statements based on political pressure rather than the science that was available?
I run a science-based agency. I'm a scientist, and the statements that I made are defended by the science.
And do you believe that any of the statements or the seemingly contradictory statements that were out there, do you think that contributed to the lack of trust in our public health system that we have today?
I would dispute the word contradictory. What happened over time is that vaccine effectiveness waned, and we got a new subvariant and variant that behaved differently in terms of how our vaccines worked. So it evolved over time. Our science changed over time. We learned more over time, and we had a new variant over time. And with that, it is my responsibility as the CDC director to update the American people with the newest science.
Well, Director Wilinski, I think that there was a lot of things that went wrong during the pandemic, but I hope that that you're going to reflect back on your decisions as well and the statements that you made in the course of this pandemic as the CDC director, because I think they drastically altered how the American public views our public health officials. I think it's safe to say that your resignation later this month is going to be an important step in returning America's trust to an organization that you did great damage to, in my opinion, during your tenure. With that, I yield back, Mr. Chair.
I now recognize.
Thank you, Mr. Chairman. Dr. Anderson, Dr. Gary, Dr. Anderson in particular here, I just wanted to address one thing here to start with. I know this has been mentioned again, but I just want to reiterate this. You emailed Dr. Fauci prior to the February 1st call, and you said, quote, "The unusual features of the virus make up a really small part of the genome," end quote. And then you went on to say, "After discussions earlier today, Eddie, Bob, Mike, and myself all find the genome inconsistent with expectations from evolutionary theory." Later on in the phone call that followed, Dr. Farzan said, "So I think it becomes a question of how do you put all this together, whether you believe this is a series of coincidences, what you know of the lab in Wuhan, how much could be in nature, accidental release, or nature event. I am 70-30. Dr. Gary, you stated, I really can't think of a plausible natural scenario where you get from the bat virus to one very similar to it, to where you insert exactly 4 amino acids, 12 nucleotides, that all have to be added at the exact same time to gain this function. I just can't figure out how this gets accomplished in nature. It's stunning," you said. All right. Nevertheless, 3 days later, and I cleared this up in the hearing, so thank you. I thought this was the initial release of proximal origins, but it wasn't. But nevertheless, 4 days later, I have this email here, and it's been mentioned already by one of my colleagues here, but I just want to reiterate it again. This is an email on February the 4th that was initiated, at least what I have here, by Dr. Holmes, who I wish was here so he could answer a couple of questions I have about this email. But it says, it's addressed to Jeremy Farrar, and it says, "Here is a summary so far. Will be edited further. It's fundamental science and completely neutral as written. Did not mention other anomalies, as this will make us look like loons." I have no idea what that means. I'd love to find out, but he's not here to answer that question. It was replied to by Dr. Farrar, who also CC'd Dr. Fauci and Dr. Collins, and said, "Please treat in confidence a very rough first draft from Eddie and the team. They will send on an edited, cleaner version later." Dr. Francis Collins replied, very thoughtful analysis, and then Dr. Jeremy Farrar replied with something, which I don't know what it is because the vast majority, every bit of his response is redacted out, so I don't know exactly what that was. But my question was, is during, you've cleared up that this was not the initial draft of proximal origins, that this was a response email or a follow-up draft report, or whatever you want to call it, in response to the phone call that took place on February the 1st. My question for both of you is, at that particular point, when this information, this draft summary was forwarded to Dr. Collins and Dr. Fauci, referencing the phone call that you'd had days earlier, were your conclusions changed? Had your hypothesis changed at that particular point?
I can take that. I think, let me just go back to the original email, because there's other sentences in that email that I think is important to. First of all, I say we have a good team lined up to look at very critically at this, so we should know much more at the end of the weekend. I also say, but we have to look at this much more closely, and there are still further analyses to be done, so those opinions could change. When you're looking at our February 4 summary, which is the one that you're referring to here, our main conclusion is that we believe deliberate engineering can be ruled out with a high degree of confidence. However, referring to both lab leaks, specifically the tissue culture hypothesis that we describe in proximal origin, our conclusion at the time of February 4th is that current data are consistent with all three. It is currently impossible to prove or disprove either.
Okay, Dr. Gary, what about you? Because you specifically said, I mean, Dr. Anderson says he doesn't believe it was engineered, but he said he hadn't ruled out a lab leak in that particular thing. Dr. Gary, you guys specifically said that, you find it completely stunning and implausible that this, that you insert 4 amino acids and 12 nucleotides, all that have to be exact same time to gain this function. That sounds like engineering to me.
Well, again, Representative Jackson, I think I started to or tried to address this before. That was a single email out of a lot of communications that I was having with people like Dr. Anderson and others. And in that particular email, I was, raising my concern about this one.
Let me ask this real quick. You reiterated, you did explain that. Let me just ask you guys real quick. So you're telling me that, and this was the actual first publication of proximal origin was published on February 16, 2020. It was posted on the website Virological. So from February 1st to February 16th, are you telling me that you gathered all of this? You gathered all of this additional information, because we know what your initial hypothesis was, or your initial conclusions were to start with before. You gathered every bit of this new additional information, which we don't know exactly what it was or where it came from. You completely changed your hypothesis. You collaborated with your co-authors, and you wrote the proximal origins paper all in that period of time. I just want to know, my time's up, but I just want you to know that sounds completely ridiculous to the American people, and it's completely in step with what a lot of people think is going on here, is that Dr. Anthony Fauci and Francis Collins realized that they had been implicated in the production or in the creation of this virus, and they were doing everything they could, including getting both of you to come on board as tools or vehicles to undermine that theory. Thank you. My time is up. Thank you. Madam Speaker, on behalf of myself, my fellow Texan Chip Roy, and over 70 co-sponsors, I urge all of my colleagues to vote in strong support of my amendment to repeal the Department of Defense's illegal and immoral abortion policy. In the wake of the Supreme Court's historic Dobbs decision overturning Roe v. Wade, the Biden administration immediately set out to sidestep the court's ruling and circumvent the law wherever possible. The Biden administration has encouraged every federal agency to create rules and adopt policies that not only expand abortion access, but also leave American taxpayers on the hook to subsidize abortion services. As evidence of this, October of last year, the Secretary of Defense released a memo titled Ensuring Access to Reproductive Health Care. This memo outlined the steps to be taken by the department in order to use taxpayer dollars to provide service members and their dependents access to abortions and allow for taxpayer dollars to be used so healthcare providers can obtain the licensing required to perform such procedures. According to its illegal policy, which is now in place, DoD can and will reimburse travel expenses for service members and their dependents who travel specifically to obtain an abortion in another state. DoD will also reimburse any associated fees for healthcare professionals seeking to be licensed in another state for the purpose of performing abortion, all on the taxpayer's dime. Last year, immediately after DOD started this unconstitutional illegal process, Congressman Roy and I got to work immediately on addressing this issue and developed a bill to right this wrong. This illegal Biden-endorsed policy has no place in our military. Taxpayer money provided to DOD is intended to provide for our national defense and our national security, not to promote and support the Biden administration's radical and immoral pro-abortion agenda. As I mentioned, regardless of your political or personal stance on abortion, this policy is in direct violation of federal law, specifically Section 1093 of U.S. Code Title 10, which restricts funds made available to the DOD from being used for abortions. No doubt my colleagues on the other side of the aisle will insist that taxpayer dollars are not directly funding abortions, thereby rendering the current policy legally sound. This is absolutely misleading. The taxpayer money is going directly to support abortions, and anyone in this chamber that says differently is blatantly lying to the American people. Taxpayer funding of travel for an abortion is, in fact, taxpayer-funded abortion. Abortion is the sole reason for these travel expenses, and this is in clear violation of existing law. My Democratic colleagues want me to blame me, Senator Tuberville, and my colleagues like Congressman Roy for jeopardizing readiness. However, it is the Biden administration who has sidestepped existing law and given the department permission to take this illegal action. This has left us with no choice but to take corrective measures and pass additional legislation. The days of the radical left ignoring the law and pushing their destructive social agenda in the military are done. I absolutely will not waver in my defense of the rule of law, therefore ensuring that taxpayer money is not used to kill innocent babies, and in doing so also ensure that our military service members can focus on the jobs that they have in front of them and their families instead of being used for the political gain of the Biden administration. This amendment has over 70 co-sponsors because we all recognize that the Department of Defense is carrying out an illegal policy that is divisive, immoral, and does nothing to provide for our national defense or promote our national security. I want to thank my friend Congressman Chip Roy for co-leading this amendment with me and for being a relentless defender of the law and a true warrior in protecting the life of the unborn. I also want to thank the Military Personnel Subcommittee Chairman Jim Banks for his support of my amendment and his work on readying our service members for the real threats that they face. Last, I want to thank Chairman Rogers for creating the strongest defense bill I have seen during my time in Congress. I strongly urge my colleagues to support this amendment to repeal this outrageous and illegal policy and prevent any similar policy in the future. With that, Madam Speaker, I reserve the balance of my time.
The gentleman reserved.